Good morning to everyone. I am Dr. Ananth, Senior Cataract Classic Smile Surgeon of Lotus Eye Hospital and Institute, Coimbatore. We all ophthalmologists are aware how the cataract surgery has evolved over last 2 or 3 decades. In the same time, eye world technologies have grossly tremendous change over the last 10 years. We have seen the change from monofocals to aspherics to multifocals to present day trifocals. Glass independence is a new norm, especially post-corona. We have seen majority of the patients who are suffering from cataract or who are planning to undergoing cataract want to be glass free. Since I am obsessed with 6x6 vision, being a refractive surgeon since 15 years, it was easy for me to convince my patients to become glass free. Post-corona, the visual demanding works have increased. People have understood the importance of near vision and computer vision. We need to provide these subset of patients a glass independence. Multifocals, which are there since last 10 years, fail to provide a good intermediate vision. Whatever the advances happens in multifocals, we can see that dysphotopics phenomenon, the amount of reduction in contrast sensitivity is significant. That's why multifocal may not be a good choice for this subset of patients. To overcome this, the trifocals have come into the role. Head-offs also have evolved along with the trifocals, but the main drawback with head-offs is a reduced near vision. If you look into these trifocals are designed in such a way that they have got two focal points which are placed between 40 to 80 centimeters. There is very little dropout between these two foci. To supply a ideal trifocal, Biotech has come out with a beautiful intraocular lenses called as Optiflex, which fulfills all the criteria which is required for an ideal trifocal. When I started looking for a good trifocal, I could see Optiflex has got a unique refractive-diffractive design. As I told, since I have been a refractive surgeon for last 15 years, we have understood how to provide a better quality and quantity of vision. Based on my principles and understanding of the refractive and diffractive details, I could see the platform which Optiflex has is very unique. It has been developed under Bliss technology, where the central refractive zone helps us to reduce huge amount of glares and halos. Majority of the ophthalmologists do have concerns with these presbyopic correcting IOLs regarding the light distribution. Because of its unique Bliss technology, we can see Optiflex TRIO has almost got 88.3% light transmission. There is a symmetrical light distribution for all the three focal points, which makes us to have a better contrast vision. And in my experience, I could see even in scotopic conditions, the near vision and intermediate visions have been extremely good in all patients who have undergone Optiflex TRIO implantation. The surrounding refractive zone minimizes the dependency on the pupil. This has got a negative aspheric surface which helps to maintain a very good contrast. This is very, very important for a glass independent patient and especially in the elderly patient. And this has got a negative aspheric surface, as I told, which provides very good depth of vision also. To prevent PCO, it has got 360 degree square head technology. I can see my patients whom I have operated, PC looks very clear post surgery. And in my experience for the post corona, almost I have done a huge number of patients. Majority of the patients I could see the reading speed is very good. The computer vision has been enormously very fast. This makes the patients very, very happy. And I could see in my practice that how Optiflex TRIO has been accepted by majority of my cataract patients. Just because this provides a very glass independent vision without any alterations in the quality of the vision. Thank you.